Hi, my name is Megan. I'm 41 years old and I have cerebral palsy. This is my 14-year-old son, Aiden, and he also has cerebral palsy. Say hi.
Hi.
Cerebral palsy is a garbage pail diagnosis given to a person who has undiagnosed or unknown causes of brain damage before, during, or soon after birth. If there's no known cause to this damage, people are given a diagnosis of cerebral palsy. There are several different types of cerebral palsy, 3 of which are forms of spastic cerebral palsy. Spastic cerebral palsy is when you have higher than normal tone. With higher than normal tone, the muscles do not contract and relax correctly. And it's always like your muscles are always working, even when you want them to relax. The 3 types of spastic cerebral palsy are spastic quadriplegia, which is where you have all 4 limbs affected equally. The next type is spastic diplegia, which is the form that both Aiden and I have. And that is where all 4 limbs are affected, but the arms are much less affected than the legs. The other form of spastic cerebral palsy is spastic hemiplegia. That is cerebral palsy or spasticity that affects one side of the body but not the other. There's also a 4th form of cerebral palsy called athetoid cerebral palsy, and those people will have involuntary, abnormal movement and oftentimes mixed tone, which means that in some areas of their body they'll have higher tone, and in some areas of their body they'll have lower tone. Aiden does very well, and he doesn't appear to want to be here right now, so I'm going to take a short video of him walking away so you can kind of see his movement pattern, and then we'll come back to me. Okay, as you can see with Aiden, I think you probably noticed foot drag, meaning he doesn't pick up his feet. You probably noticed that his left knee falls in and his left foot turns in. And you probably also noticed the excessive amount of trunk movement or use of his back that he uses in order to walk. He can walk differently than that. He did have a minimally invasive surgery last June, and if he really concentrates, he can walk with very good heel toe, with his feet pointing forward, and with a little bit less trunk movement. Aiden and I although we have the same form of cerebral palsy, Aiden is a gross motor functional level higher than I am, meaning he functions at a level that is higher than my level of function. He is a gross motor functional level of 2. I am a gross motor functional level of 3, meaning I require an assistive device to walk. At least outside of my home, I use wooden forearm crutches in order to walk. Without them, I fall. Within the house here, I tend to furniture walk or use the walls. Aiden is a gross motor functional level of 2. This means that he can walk independently without an assistive device. And he does that both inside and outside of the home. Another characteristic that we both share is poor trunk control overall, meaning our balance is thrown off and we tend to fall. Our core strength is not normal. So the biggest things that happen for him are balance checks, falling, and just a generalized weakness. And because of the spasticity, his muscles don't contract and relax smoothly like they should, giving him that awkward, abnormal gait pattern. those same things happen with me, but to a higher degree. Meaning I tend to fall more than he does, but not much more, but more than he does. I tend to have a much more abnormal gait pattern, and I will demonstrate that later. But overall, none of us, we don't have cognitive delays, speech delays, or seizures, which in about 50% of the population that has cerebral palsy, those three things can be present. Now, Aiden did have seizures before the age of 4, both febrile seizures and focal seizures, but has not had a seizure and is not on seizure medication for the last 10 years. I have never had any of those. So we are very lucky to be at the level that we are. Now, I am very functional. I work as an occupational therapist outside of my home. I treat patients on a daily basis. I work full time. I drive with my hands. Aiden is very functional. He goes to school full time. He's in a typically developing program with all of the typically developing peers. He will take driver's ed this year coming up with a spinner knob, and he will at this point use his feet. Now if they think in driver's ed that he is not safe, he will switch then to hand controls. I do require hand controls to drive. So as far as his accommodations at school, he gets a hall pass so to get out 5 minutes early from every class so that he's not in a crowded situation when he is walking down the halls. Additionally, we have him walking in the halls with a peer. This is not meant, we do this to not because we think that's going to save him from falls, but our hope would be that at least somebody is with him if he were to fall and hit his head or truly hurt himself and not be able to get up. Additionally, he gets to the front of the lunch line, and we just do these types of things that give him more space so that he's not hurried and so that he is not run into and at a higher risk of falls. As far as educational accommodations, he has no special education goals at this time. He does use Dragon Naturally Speaking, which is a speech-to-text recognition program, because he struggles, as well as I do, with fine motor skills, meaning he has a really hard time writing. He writes, his 14-year-old writing is more consistent with the legibility of a third grader. He knows his thoughts, and he is very intelligent, but he has a hard time putting them down on paper. So he does use a speech-to-text recognition program to write papers, to give speeches, maybe, to write essays, to answer problems. Additionally, this year coming up, he will get a specialized math program on his computer that will perform equation tasks for him as he verbally puts them in, so that he doesn't have to write 28 steps to an algebraic equation to save him that fatigue level. As I explained earlier, he does have weakness in his hands, ligament laxity in his hands, and decreased fine motor skills, as well as I do. I'm very left-handed. I'm very left side dominant. He's very right-handed, very right side dominant. I'm not sure why that is. But all in all, we are very functional people and very blessed to have the abilities that we have in the times that we have. And at this point, Aiden also does not have a para or a one-on-one aid. He did up until 4th grade, and then he began to just use a heavy accommodation plan. We plan on that accommodation plan being